My name is Mary. I'm a family medicine resident at the Eastern Virginia Medical School, and this is my research project, which is a review of the dose-response relationship between various foods and nutrients and risk for breast cancer. When it comes to breast cancer, we know that 5% of cases are due to a single gene, 20% are due to family history, and the remaining 75% are due to both lifestyle and environmental factors. There is a long list of lifestyle and environmental factors that influence risk for breast cancer, and nutrition is one piece of this very large puzzle. Despite only being one piece of the puzzle, a randomized controlled trial showed that just dietary changes alone can influence risk for breast cancer. But despite the fact that the best evidence shows that the Mediterranean diet is the best way to do this, this is not ideal messaging for our patients. Now, there is association-based data that exists, published in this review, that identified a number of foods and nutrients associated with increased and decreased risk for breast cancer. But when we tell patients about diet and breast cancer, we can't just tell them what to eat. We also need to tell them how much to eat and how often. So the objective of my research study was to update this existing review and extract data regarding the quantities of different foods that are associated with risk for breast cancer, to compare those quantities to established dietary recommendations, and ultimately to translate all of this into some sort of knowledge translation product that I can use to educate my patients about how to use diet to decrease their risk for breast cancer without just telling them to go on the Mediterranean diet. So this was how all the data was extracted. We started with that existing review, reviewed their meta-analyses. I updated the review, reviewed additional abstracts, and in total, we wound up with 9 meta-analyses, 2 prospective cohorts, and 1 case control study informing our results. And what we found is that every 100 grams of fruits and vegetables that's eaten per day decreases relative risk for breast cancer by 3%. This is a very fair amount, half of an apple, 1 banana per day. Every 1 gram of mushrooms that's eaten per day decreases relative risk for breast cancer by about 3%. This is interesting because 1 mushroom alone is 5 grams, so even 1 little bite of that mushroom makes a difference. And if you look at the dose response curve, it's very interesting. 1 mushroom is good, 2 is even better, 3 is even better, and 4 is even better than that. This is a logarithmic scale, so it's slightly masked, but if you eat 4 mushrooms per day, this research suggests that your relative risk for breast cancer decreases by 45%. Dietary folate, every 100 micrograms that's eaten per day decreases relative risk by 5%. You can get 100 micrograms from half of a cup of beans or 2 cups of dark green leafy vegetables. And the maximal dose response is at about 400 micrograms per day, which is pretty consistent with the daily recommendation that we already have. Every 10 grams of fiber that's eaten per day decreases relative risk for breast cancer by 5%. You can get 10 grams of fiber from half of a cup of beans or an apple and a pear. If you look at the dose response curve, it's very interesting because the daily recommended intake level for women is 25 grams. But if you have increases of intakes of fiber that are above that recommendation, you have additional reductions in breast cancer risk. Every 5 milligrams of beta-carotene that's eaten per day decreases relative risk for breast cancer by 7%. You can get that 5 milligrams from half of a sweet potato or half of a cup of raw dark green leafy vegetables. Lignans, which are a type of phytoestrogen, a plant-based estrogen mimicking kind of molecule, we know that every 1.2 milligrams that's eaten per day decreases risk for breast cancer. You can get that from 1 tablespoon of crushed flax seeds. Soy isoflavones are another type of phytoestrogen, and the data shows that every 10 milligrams that are eaten per day decreases relative risk for breast cancer by 3%. You can get that from 1/8 of a cup of soybeans or 1/4 of a cup of tofu. If you look at the dose response curve, it's interesting. If you max out with 1 cup of soybeans per day, you decrease your relative risk for breast cancer by about 30%. Now, if you stack all those foods together, you can see that beta-carotene has the greatest relative risk reduction with about 7%. But keep in mind, this comparison is relative to the amount that's being consumed. And if you look at the maximal risk reduction from the dose response curves, interestingly, mushrooms turn out to have the greatest effect with a relative risk reduction of 45%, followed by soy isoflavones and fiber, which if you max out your consumption, decrease relative risk by 30%, and finally, fruits and vegetables with 10% reduction. Now, there wasn't enough time here to address the foods that increase risk for breast cancer, but really quickly, those were red meat, processed meat, and high glycemic index foods. And ultimately, we put all of this together into this knowledge translation product to inform our patients of which products, which foods and nutrients might increase or decrease their relative risk for breast cancer, which is available from my little passion project, a website called nutrition-prescriptions.com. And of course, no study was without limitations, and this study is no exception. The limitations were that this is all based on observational data, which shows association but not causation. Also, breast cancer is not one entity. There's premenopausal, postmenopausal, all the different estrogen receptor statuses. And also, this is about primary prevention, but not necessarily secondary prevention. So in conclusion, there's a large amount of research that substantiates the benefits for diet as a way to decrease risk for breast cancer, and often the quantities of foods that are associated with risk are reasonable quantities that anyone could incorporate into their diet. And that's everything.